ورحمة الله وبركاته. أهلا بحضراتكم. إن شاء الله النهاردة مع تاني فيديو لينا عن Scapular retraction exercise. In this video we will discuss the study done by Oyama et al. In 2010 where they described and compared scapular and clavicular kinematics and scapular muscle activity between 6 different retraction exercises. Specifically, they measured scapular upward downward rotation, scapular posterior anterior tilt, scapular internal external rotation, clavicular retraction protraction, and clavicular elevation and depression. They also measured the activity of upper, middle, lower trapezius and serratus anterior muscles. The aim of this study is understanding variations in retractor muscle activity and scapular and clavicular movement, which in turn may help guide clinicians select exercises that are most appropriate for each patient. The first exercise is scapular retraction exercise at 90 degrees of shoulder abduction and neutral humeral rotation, in which the palm is facing the floor. The second exercise is scapular retraction at 90 degrees of shoulder abduction and external rotation. Thumb is pointing towards the ceiling. The third exercise is scapular retraction at 120 degrees of abduction and neutral humeral rotation, palm facing the floor. The fourth exercise is scapular retraction at 120 degrees of shoulder abduction and external rotation, the thumb pointing towards the ceiling. The fifth exercise is scapular retraction at 45 degrees of shoulder abduction and 90 degrees of elbow flexion. The final exercise is scapular retraction with full shoulder extension. For all exercises, participants were instructed to lift the arms towards the ceiling and hold while squeezing the shoulder blades together. Variations in scapular and clavicular movement and muscle activity among these exercises may provide insight on how clinicians can choose appropriate exercises for their patients based on pre-existing conditions, available range of motion, and the need to focus on targeting specific kinematic movement or muscle activity. Both exercises 2 and 5 resulted in significant scapular external rotation, upward rotation posterior tilt, and clavicular retraction from neutral. So, this exercise may be recommended if the goal of the rehabilitation is to mobilize the scapula about multiple axes. Both exercises 1 and 2 are performed at 90 degrees of humeral elevation. With exercise 1, the palm is facing the floor, and exercise 2, the thumb is pointing up. While both exercises resulted in significant scapular external rotation and retraction from neutral, exercise 2 resulted in significantly greater retraction from neutral compared to exercise 1. Also, exercise 2 resulted in significant scapular upward rotation and posterior tilt. So, exercise 2 may be superior to exercise 1 if the goal is to optimize clavicular retraction movement and also to optimize scapular upward rotation and posterior tilt from neutral. In addition to producing significant scapular upward rotation and posterior tilt, exercise 5 resulted in significant scapular external rotation compared to all exercises. So, if the goal is to optimize scapular external rotation movement, this exercise may be recommended. Also, exercise 5 is performed at relatively low humeral elevation angle, which has two advantages, is that this exercise can be used with patients with range of motion restriction and also with patients with subacromial impingement. As shown in the literature, increasing humeral elevation angle decreases subacromial space. Both exercises 3 and 4 are performed at 120 degrees of humeral elevation. With exercise 3, the palm is facing the floor, and exercise 4, the thumb is pointing up. Both exercises resulted in significant scapular upward rotation compared to all other exercises. This result is consistent with the literature demonstrating that scapular upward rotation increased with increased humeral elevation angle. Also, both exercises resulted in significant scapular posterior tilt and retraction, but not scapular external rotation movement. There was no difference in kinematics or muscle activity between both exercises 3 and 4, which means that scapular retraction exercises at 120 degrees of humeral elevation can be performed either with the humerus in neutral or external rotation. Exercise 6 resulted in higher activity levels for the lower trapezius muscle and the low level of activation of the upper trapezius muscle. So this exercise is indicated when the goal is to activate the lower trapezius while maintaining relatively low upper trapezius muscle activity. We hope you enjoyed this video and stay tuned for the next one.